Hi, I'm Stephanie Collier, and I am doing my internship at the North Mississippi Medical Center Behavioral Health Center. It is an acute adult inpatient facility at Tupelo, Mississippi. I started my internship there on August the 20th, and since then I have learned so much. One of my strengths, I believe, would be that I'm more a people person. I like to sit down and talk to people and see how they're feeling and see what their behaviors are. The weaknesses that I see is sometimes I don't pick up on some key words like overwhelming or hard, and I need to learn how to follow up with those types of words that the patients are saying to me, and get a little bit more detailed in the interviews that I have and the assessments, especially the psychosocial assessments. The patients that we have that come to the Behavioral Health Center are patients that are dealing with some type of psychosis, especially if it leads to suicidal ideations or homicidal ideations. Some of these patients come in and they're having visual and audible hallucinations, thinking that they're hearing voices that are telling them to do things that are not healthy for them or any other people for that matter. Some people come in violent, some people come in depressed, a lot of anxiety. The downfall of my internship, one thing that I would like to see changed is that it's a short stay. I don't see people staying there for any prolonged time. It's more of like from 2 to 3 days to 2 weeks. I think 2 weeks is the longest that I have seen someone be a resident at the facility. And sometimes it takes a little longer to have a breakthrough and have an eye-opener. The treatment and therapy that we mostly use at the Behavioral Health Center is the dialectical behavioral therapy, where we focus on mindfulness, we focus on radical acceptance, whereas we encourage the client that in order to get freedom from suffering, it requires acceptance. So that's what we do with radical acceptance. And of course, the dialectical behavioral therapy is a type of cognitive behavioral treatment. And that's the things that we do is when a patient comes there, we have 2 units. One unit is a little more acute than the other unit. One unit is more for the psychosis, the audible visual hallucinations, suicidal thoughts. That is the more acute. Whereas the other unit is more of mental health. They're needing some kind of treatment for depression or anxiety, and a lot of the patients that come there have experienced some type of dual diagnosis, whereas they have experienced with or experimented with some type of recreational drug in order to be self-medicating, and they do that to try to get rid of the voices and the behaviors and the visions that they have. They're thinking that these drugs can help to alleviate some of those, and we're trying to give them cognitive behavioral therapy in order to shed some light on that and tell them, well, not really tell them, but educate them on how those drugs can be very harmful for them and that they should be compliant with their medications that the doctors have them on. Sometimes the patients do have a breakthrough and they do much better. Some patients are leaving AMA, which is against medical advice, and they wind up coming right back. And other patients, they make the decision to go into some type of inpatient rehab or outpatient rehab facility and get some outdoor counseling that way. I do think that I am proficient where I stand right now with all the required competencies. I do think that there is still a lot to learn. I think being a social worker, period, is an ongoing and continuous educational career that we all have to go to. And that's the reason why we have to keep up with our CEUs, because there's still a lot to learn no matter what your degree is. I do think that this has been a real good experience for me. I've not dealt with someone. Now, I did do an internship for my bachelor's degree at NMRC, but it was more of the schizophrenic. But the people that come in there usually just need someone to sit down and listen to them. They don't need someone that is going to come in and just try to shuffle them out and get them in and out as quick as possible. They are the staff that is working there is very compassionate about what they do. They're very concerned about the people that are the patients that come into behavioral health. They are genuinely concerned about trying to get these patients well, trying to get them back to being a functional human being on the outside. They measure people by doing psychosocial assessments. We also do 2 groups a day for both units, and they also have visitations on Sundays, and they do have 2 separate recreational times a day. And during those times, we measure the patients by their behavioral functioning, their anxiety levels, their anger levels, the depression rates, things like that. And I still think there's a whole lot to learn. I've not been able to see what Malcolm Bell does. Hopefully during my next semester I'll be able to do some type of inpatient assessments with him and see exactly what it is he does. I have been working with Miss Susan Shue. She's amazing what she does, and I love the constructive criticism that she gives me, because I need that. It's something that I have to learn from, and I do commend her for that. She is very educated in what she does. But I wasn't able to work with Malcolm because when I first started, his daughter had a horrendous ATV accident and had left her paralyzed, and he's been with her for the first part of my field placement. So, and when he come back from dealing with his issues there, he got the flu. So, hopefully the next semester I will be able to work with him more and see what it is that he does in order to decide whether or not the patient is eligible for admissions for the Behavioral Health Center. So I have really enjoyed it. I look forward to the next semester. Actually, May can't get here quick enough for me. But anyway, I do enjoy it. I am enjoying it, and I look forward to next semester. Thank you.